Good morning, everyone. Welcome to today's live update. I am Chancellor Donde Plowman, and I am here this morning with Dr. Spencer Gregg and Provost John Zomchik. I want to go off script for 1 minute and let everyone know that earlier this week, Dr. Spencer Gregg was one of two people, along with Brian Gard, who received the Volunteer Spirit Award. That is the highest award given to a staff member on our campus. And they received this award, Dr. Spencer Gregg, I want to talk about specifically, because they are the two people, he and Brian, have kept us safe this whole year. And Dr. Gregg has signed on for way more than a health center director ever imagined doing. He's been available 24/7 to all of us for over a year, and we wouldn't be here today without his leadership. So Dr. Gregg, thank you so much, and it was so well deserved, that award. It was a joy giving it to him. Now, back to the script. Dr. Gregg is joining us, as he does most Fridays, from one of our public vaccine clinics over at the Student Union. It is a fitting setting because today I want to start with talking about vaccines. Everyone is now eligible to get a vaccine, everyone age 16 and over, and we encourage all of our students, faculty, staff, as well as the broader public to schedule your vaccine as soon as possible. Please schedule your vaccine as soon as possible. We especially want our students to get their vaccine immediately before the end of the semester. Here on campus, we are offering the single-shot Johnson & Johnson vaccine, sometimes referred to as the J&J vaccine. That means you can get one shot and be done with it. No need to schedule a second dose. If you are a student, faculty, or staff member, you can sign up for a vaccine appointment at the Student Health Center. We are offering appointments every week. We are also holding at least one public vaccine clinic per week, sometimes two. Students, faculty, and staff can also get their vaccine there, along with members of the public. We have plenty of vaccines available next week. To schedule your vaccine, go to www.utk.edu/coronavirus/vaccine, or go to our coronavirus page and you will find a vaccine tab at the top. From there, you will find all the information you need on how to make an appointment. We've tried to make it as easy as possible. So Dr. Gregg, I'm going to turn to you. How important is it for individuals to receive their vaccination?
Good morning, Chancellor and Dr. Zomchik. It's great to be with you again today. The importance of getting your vaccine can't be overemphasized. Aside from all current health and safety guidance like mask wearing, remaining socially distanced, washing your hands, avoiding group gatherings, the vaccine is the only thing that potentially gets us through the pandemic. Studies have shown, and experience is now teaching, that the vaccine is safe and effective for the vast majority of the population, and it's our greatest hope for a future without COVID restrictions. We really encourage everyone to get fully vaccinated.
So that term, fully vaccinated, when are you fully vaccinated and what does that mean for you?
Well, to be fully vaccinated means that you're at least 2 weeks beyond receiving both doses of the 2-dose COVID vaccine, which are the Pfizer and Moderna vaccines, or 1 dose of the single-dose vaccine, which is the Johnson & Johnson vaccine. While we're glad to see our community being vaccinated, and we're working hard to get everyone vaccinated across campus, our requirement for masks and social distancing will remain in effect through the end of the semester, allowing the percentage of our community fully vaccinated to continue to grow. Everyone, including the fully vaccinated, should still submit their daily health self-check app and complete a self-isolation form when they're requested to do so. Once the self-isolation form is submitted, in order to confirm appropriate next steps that are consistent with current CDC guidance, our contact tracing team will reach out to those who've submitted the self-isolation form and gather some additional information, including their vaccination status. Several CDC recommendations have been recently updated for the fully vaccinated and could permit fewer restrictions in certain circumstances. These updates include new guidance for mask wearing, quarantining, and travel. Importantly, we also want students to be aware Those confirmed by a contact tracer as fully vaccinated will not have to participate in saliva testing for the remainder of the semester, and in some cases may not have to quarantine if they're exposed to someone who's tested positive for the virus. So beyond looking out for the health and well-being of yourself and the community at large, there are plenty of great reasons to get vaccinated, and we're really glad to see these changes developing.
One more thing, I understand we hit an exciting milestone today. Can you talk about that?
Well, good news certainly travels fast. You are correct. We gave our 10,000th vaccine dose this morning at the student union, and fittingly, it went to a UT student. That was a great feeling for all of us. But Chancellor, we want even more students to get vaccinated, and there'll be a lot of other opportunities to do so, both on campus and in the community. So everyone needs to be looking out for those opportunities at the COVID vaccine website.
That is just incredible. You know, Dr. Greg, Provost Zomchik, we've been through so much over the last year. When you look back, it is overwhelming to think about how far we've come. I just got goosebumps when you said it was a student. That's so awesome. There is work we have left to do, though, and it includes getting our entire community vaccinated. So please sign up for your shot if you haven't already. I've been talking to students out on campus, and many of them tell me I'm already fully vaccinated, mostly because they got the J&J and they only need one shot. So that's fantastic. Widespread vaccination is our way out of this pandemic. And it is the reason we plan to return to full on-campus operations this fall. And that's what I want to talk about next. Really exciting. So our return to campus. This week, we notified our campus community that we plan to bring staff back on June 1 to begin preparing for the fall semester. Our staff have been incredible. They have been resilient and creative, working remotely, supporting our students and our mission every day, day in and day out. And I'm excited to have everyone back on campus and to see this place humming again. The Office of Human Resources is working with individual units on their plans, and supervisors have until May 10th to devise a plan for what their workplace will look like. We will continue to adhere to all guidelines around masking and social distancing until the guidance from health experts change. With that in mind, I want to talk a little bit about the fall semester and what that will look like. So, you know, Dr. Zomchik, I'm coming to you. What can students expect this fall, and what should they be doing right now to prepare?
Thank you, Chancellor. It's good to be with you. It's great to be with Dr. Greg, and congratulations, Dr. Greg, on a much-deserved award. Our hearts go out to you. You've gone above and beyond what we even expect of volunteers. So what should students be doing now? Well, registration for fall classes started on Monday, April 5th. As soon as students become eligible to register for fall, and there is a rolling eligibility period, please go ahead and register for those classes. And I want to emphasize what Dr. Greg and what Chancellor Plowman has been saying all along. If you haven't already done so, get an appointment to get vaccinated. Do it now before you leave campus. It's really the volunteer way, the volunteer thing to do. Vols help Vols, and you'll be helping all of us by getting your vaccine. I'm happy to say that today is my 2-week anniversary of my second shot, and so now I'm fully vaccinated. Let me say a word about what you can expect in fall semester. So the vast majority of our classes for fall will be in person. So you can all count on a typical residential experience for fall. Our classrooms will be at full capacity. Our residence halls will be at full capacity. Most of our campus will once again have that buzz and energy that I, for one, have missed this year. Nothing really compares to the feeling that I get when I see thousands of students on our pedestrian walkway going to class. And that's what we expect fall semester is going to look like. In addition to that full capacity classrooms and residence halls, we're also going to have a full slate of events for students, and we're all looking forward to that as well, Chancellor.
Okay, so that's so exciting thinking about fall. But let's back up a little bit. What about the summer term? Can you talk about that a little bit?
I can talk about that. So summer term is going to look a lot like spring. As you said, we want to proceed cautiously until we can be assured that everyone or as many people as possible are fully vaccinated. I like to think of it as putting a stake in the heart of the novel coronavirus once and for all. So, but as your chancellor, even before the pandemic, we began putting many of our summer offerings online for the convenience of our students so that they could register for summer courses and take them from their home if their home isn't Knoxville. We'll continue that this summer, but we'll also have some traditional in-person classes in socially distanced classrooms. So the key word is caution until we get to the point where we can feel good about having the majority of our community fully vaccinated.
Summer is a great time. I love the fact that we have online classes in the summer. It's a great time to move closer towards your graduation goals. And so to get a few more hours under your belt. My children, as a mom, use that, and I highly recommend it. So I'm glad to hear about that. So let me just reiterate, we will be returning to full capacity this fall. That means classrooms, dorms, events, dining halls. The best way to protect yourself and others is to get vaccinated. Please visit the vaccine page on our website to schedule your shot. Of course, we will continue to listen to public health experts and maintain health precautions until they are deemed no longer necessary. Right now, today, that means continuing to wear your mask, participating in community testing, washing your hands, and enjoy the company of others outdoors. I just had a meeting this morning in my office. I'm fully vaccinated. All 5 of us had our masks on. Other people in the room had not been vaccinated. And we'll continue to function like that, as we said, until further notice from the health experts. So finally, our last topic today is our current COVID case count and trends. So let's look at that data. Let's talk about positive cases. As of this morning, if you take a look at that, 41 active positive COVID-19 cases. I'm feeling good about that number. 41 more than we want, but 41 is a lot better than other numbers we've had. 40 of those are students and 1 is an employee. We now have, on the next slide you see, 137 people in quarantine or self-isolation. This includes 67 students who live on campus, 55 students who live off campus, and 15 employees. Let's talk about testing. Last week, we tested more than 1,700 saliva samples from students in pools of 3 to 4 samples. Based on those results, we sent 65 individuals to receive diagnostic testing. Of those who were tested, we identified 15 positive individuals. The overall participation rate for residential students dropped again this week to 40.6%. Our positivity rate across all samples was 0.83% of 1%. It's almost 1%. Now, I want to remind our residential students, I know you're feeling like it's spring. I'm tired of COVID. I've already had it. I don't care. Please, I want to remind you that we still need your participation. If you are vaccinated, you are exempt from testing. So that's another reason to get your shot. You don't have to keep spitting in the tube every day. But otherwise, we need you to, because as you can see, we found 16 cases. And when we can isolate them, put those folks over where they can't spread the virus, that's the whole point of this. So please continue your participation. So let's just summarize overall. If you look at our metric summary, as a reminder, this table tells you these are the factors, the dimensions we're watching. We have been all year. And it helps us know when we can ease or lift the temporary restrictions. Dr. Gregg, how are things trending in our broader community? Can you speak to that?
The Chancellor, as you can see on campus, both our active cases and new cases are starting to once again trend downward. as are our overall self-isolations. So we're now heading in the right direction. But we still need optimal participation in our saliva testing for our students on campus positivity rate to remain meaningful. So please, students, continue with our saliva testing program. In the greater Knoxville community, we're seeing more of a plateau or even some drop in regard to their numbers. Their new COVID cases per 100,000 are continuing to gradually decrease. Knox County now stands at 10 cases per 100,000. But hospital and ICU use have appeared to have plateaued somewhat. This data suggests that we're slowly getting to where we need to be, but it's not a done deal. We could still easily swing in the opposite direction if we don't remain vigilant. We all must continue to wear a mask, continue to socially distance, avoid gathering in groups where folks are eating and drinking and where those guidelines aren't being adhered to. These are our greatest risk situations and still need to be avoided. To further reduce their own risk of infection and the infection of others, everyone who can needs to get vaccinated. The end of this pandemic is just in sight. We just need everyone to adhere to the current guidance, stick with the plan just a little while longer.
Dr. Gregg, as always, thank you for that helpful information. That's all we have for today. I think that's another good news. These are getting shorter and shorter. There's less to talk about in a way. But once again, if you take away any message from today, there's one message: get vaccinated. Let's remain vigilant, wear your masks, spend more time outside. It's beautiful out there. We are so close to resuming so many of the things that we love. We can do this, Vols. I know we can. We've been doing it just a little bit further. So I hope you all have a great weekend. Go Vols. We've got baseball and softball games going on and other events. Go Vols to every team and enjoy the beautiful weather. Thank you.